Okay.
Cool. Right, so good evening, everyone. Thank you very much for joining Tamsin and myself. I want to talk about hormones, feet, and fat watching. So I will introduce our first speaker. We are very pleased to have Nicky Housby Skeggs with us, and she's the veterinary director at T. Nicky graduated from the Royal Vet College in 2007 and then joined the Royal Army Veterinary Corps. She served there for 10 years, firstly working with military dogs and getting them and their handlers ready for deployment, and then later on as the veterinary officer for the King's Troop Royal Horse Artillery and the Household Cavalry Mounted Regiment. And that's where she developed the large animal rescue training as a core activity for the regiments. After leaving the military, Nicky worked as an equine vet for 2 years before moving on to the charity sector. And her work at the Horse Trust involves providing internal and external training for vets and the veterinary care for the resident horses at the Horse Trust. And Nicky is also the chairperson for the board of directors for the British Animal Rescue and Trauma Association, or BARTA. So I'm very pleased then to I will stop sharing my screen, and then I will then pass on to Nicky to start her talk. So if you just unmute yourself, Nicky.
I'm unmuted.
There we go.
Can you hear me?
Brilliant.
Perfect.
Yes.
Okay, right. Let me just share my screen, and we should be, here we go. Is that, can you just see the presentation?
Yes.
Okay, lovely. You haven't got all the background stuff that I've got on my screen.
We've just got your PowerPoint.
No, yes, the PowerPoint, but it's not in the sort of presenting view yet.
Why is that? Hang on a minute. Has that done it?
Yes.
Yes, perfect.
Lovely. Okay, there we go. Okay, so well, firstly, thank you very much for inviting me to talk tonight, and thank you to everybody for coming along. And hopefully what I'm going to do is give a bit of an overview of the link between laminitis and equine metabolic syndrome, obesity, and Cushing's disease. And hopefully we get lots of good questions so we can have a really good discussion at the end of the talk. So the first question which I want to answer is, what is laminitis? So, you know, it's a painful condition affecting the horse's feet, and it's actually the laminae of the feet where the sensitive and insensitive part of the feet join together, and it becomes very inflamed, causing kind of your increased pulses, your heat, and your inflammation. Yeah. And if this is allowed to progress, eventually you'll get rotation or sinking of the pedal bone due to the breakdown of those laminae. And you'll get some permanent change to the feet, and if it becomes so debilitating that we're unable to kind of get on top of the pain, then it can lead to euthanasia. So there's just some pictures of what's going on inside the horse's foot. So the picture on the left is a normal pedal bone inside a normal foot, and the one on the right just shows that rotation and that sinking of the pedal bone. You can see how close the tip of the pedal bone is to kind of coming through the sole at the bottom there, and you can see the kind of thickness of the hoof wall between the metal marker and the part of the pedal bone there. So what are the causes of laminitis? So there are loads and loads and loads of things that will cause laminitis. So metabolic syndrome, obesity, endotoxemia, we talk about this grain overload or grass overload, concussion, and pretty much anything that goes wrong with a horse eventually can lead to laminitis. One of the theories is that in some of these diseases, actually what's happening is it's not just happening in the laminae, it's happening in other parts of the body. So say, for example, the liver. But because you've got this tough sort of capsule surrounding the foot, the inflammation there hasn't got anywhere to go. So you've got this compartment syndrome where you've got swelling inside a confined area, and that's why it becomes so painful, and that's why you get this cell death, that perhaps other parts of the body are just allowed to swell without that kind of hard capsule, and so they can swell, the blood can all flow around, they don't get death of those cells in the same way. And the other thing, there's almost certainly a genetic component to this, because some horses go through absolutely everything and never ever develop laminitis. Others seem to develop laminitis just from sort of breathing when the wind's in the wrong direction. So there's got to be some sort of genetic component to all of this. So the things we normally talk about in terms of prevention are weight management, diet, exercise, good farriery, and early diagnosis and treatment of any underlying diseases that might lead to laminitis. In terms of treatment, the sort of things we're looking at, pain relief, resting them, diet, again, good farriery, foot support, and treating any of these underlying diseases that we recognise. So the thing I want to talk about is what actually causes laminitis. So we've got these links to obesity, to PPID or Cushing's disease, to equine metabolic syndrome, carbohydrate overload, and this sort of secondary effect of inflammatory disorders, which we normally see in sort of more of a hospital setting. But all of these things, they don't always cause laminitis. And there's lots of sort of studies and experiments where laminitis is artificially induced. So there's different models using, for example, black walnut toxins, a really common one they use. And you can also use mechanical things like putting screws through feet to try and induce this experimental laminitis. But the only experimental model that always causes laminitis is hyperinsulinemia. So essentially too much insulin circulating in the blood of the horse. And that is the only thing that reliably always will induce it. And this is something we quite often see in horses with Cushing's and horses with equine metabolic syndrome. So just to kind of talk through these different problems. So pars pituitary intermedia dysfunction, or Cushing's disease, which is a lot easier to say, is essentially we get this sort of enlargement of this part of the brain called pars intermedia, and it increases the secretion of a hormone called ACTH, along with a couple of other hormones, endorphins being one of them. And this then increases the levels of circulating cortisol, which is a steroid, in the blood. And there is a link between that increased cortisol and increased circulating insulin. And again, we come back to this insulin, which is one of our kind of known causes of laminitis. So these Cushing's ponies, the ones you see that don't lose their coat in winter, have this really curly coat, they sweat, they have a really abnormal fat deposition, they get muscle wastage, often laminitis, they're quite often sort of just a bit under the weather, a bit lethargic, and they also, they'll drink more, they'll urinate more. But these horses aren't necessarily overweight. So the question is, does PPID cause laminitis? So it can, and it's quite often linked to laminitis, and quite often ponies with laminitis will be diagnosed with PPID or Cushing's. But not all horses with PPID have laminitis. And often, just a sort of point of interest, often laminitis in these cases, a lot of horses with Cushing's are older horses, and they'll have other problems at the same time. So arthritis is really common in older horses. So often the laminitis goes sort of undiagnosed, or is assumed to be it's assumed that this horse is moving abnormally because it's got arthritis. Because it's got arthritis, they'll be on some sort of pain relief, some sort of anti-inflammatory, and that means the laminitis perhaps is actually sort of kept under control or suppressed. So obesity. So obesity is essentially our medical condition. We've got excess body fat to the point where it's having a negative impact on that horse's health. And this is going to increase our likelihood of lots and lots of different problems. There's extra stress on the cardiovascular system. It can lead to equine metabolic syndrome, which we'll talk about in a bit. It increases if you've got osteoarthritis. Carrying extra weight is going to make that more painful. But also, actually, these obese horses are more prone to inflammation. So arthritis is essentially inflammation in the joint. So if you've got a horse that's more prone to inflammation, it's going to be more prone to arthritis. And also there are links between obesity and depression in humans. We don't have a proven link in animals, but there's a reasonable, I suppose it would make sense that this might be a possibility in horses. So as we said, some of the sort of problems associated with having a high body condition score or having obesity, is increase in lameness, laminitis, increased strain, the impact on the immune system, and actually, more management issues like, your tack not fitting, tack rubbing, because it's not designed to be on a horse of that shape. Often these horses are more difficult to treat because of the excess weight. So things like getting them exercising is more difficult. They're more prone to have problems foaling. And I guess, quite often these horses will also have a lack of muscle, and therefore things like back pain are going to be more common. So does being fat cause laminitis? So again, not necessarily, but it does predispose these horses to having equine metabolic syndrome. And also if they get laminitis, say an inflammatory cause of laminitis secondary to a colic or something like that, that increased weight that they're carrying is going to put increased pressure on those sensitive laminae. So if something else were to cause a laminitis, that excess weight is really not going to help that condition and not going to help our ability to treat it. So coming on to equine metabolic syndrome, it's most often seen in obese horses, but not all obese horses will have equine metabolic syndrome. You very occasionally can see equine metabolic syndrome in a horse that's not overweight, but it's less common. So the sort of assumption is that there must be some sort of genetic predisposition for a horse to get equine metabolic syndrome, because you can have very overweight horses that don't get it, and you can also have the occasional underweight horse that get it. So potentially there's a genetic predisposition to having equine metabolic syndrome, and perhaps obesity is the trigger for this in some horses. These horses often, the difference between a horse that's just overweight and a horse with equine metabolic syndrome is actually the fat tissue or the adipose tissue actually doesn't function normally. So you'll get some horses that are fat and they have lots and lots of small fat cells, or you get horses that are fat but they have big fat cells. So that seems to be the kind of difference between the two. And it's this sort of dysfunction of the fat tissue that gives them equine metabolic syndrome rather than just the fat tissue itself. And what we do see in these horses is that they have impaired insulin signaling. So again, they have this hyperinsulinemia, so this massive circulating insulin. And as we said at the beginning, this high insulin level is what we see when we get these cases of laminitis. The other thing with equine metabolic syndrome, it does appear to predispose these horses to developing PPID or developing Cushing's later on in life. So the question of, does EMS cause laminitis? Again, not always. You get horses with equine metabolic syndrome that don't develop laminitis, perhaps because you catch it early enough. But we know that this high insulin is the one thing that can reliably cause laminitis. Therefore, having a horse with equine metabolic syndrome, we're really running the gauntlet of getting laminitis in these cases. So obesity, we know, has a negative impact on welfare for lots and lots of reasons. And one of those things is that it's this increased sort of likelihood of developing inflammatory disorders, so increased chance of them developing lameness, and also they're more difficult if they do develop lameness to then treat. Equine metabolic syndrome is a common sequelae to obesity, and laminitis is a common result of equine metabolic syndrome. Equine metabolic syndrome then predisposes these horses to developing Cushing's, and Cushing's is also a trigger for laminitis. So hopefully that is clear as mud how they all fit together at this stage.
Awesome. Thanks very much, Nicky. That's really good sort of overview of EMS, PPID and laminitis. And hopefully, if you guys do have any questions for this part of the talk, just pop them in the chat, and then we'll deal with them at the end for sort of our joint Q&A. And if Tamsin is around, I think she is going to introduce our next speaker.
Yes, I am. I just wanted to say, I think the talk was really nicely summed up by Katie, who has just has said basically the outcome is don't let your horse get fat. It's probably a great sum up there. So thank you. Okay, so our next speaker is Georgie, and then we'll be coming back for questions. So I can see people already starting to put questions. If you put your questions now, Dee and I will be collecting them throughout the talks, and then at the end we'll have we can go back to both speakers and ask questions. So our next speaker is Georgie, who is a brilliant farrier. So Georgie's going to be talking about laminitis, a farrier's perspective. She's been working in farriery since 2008 and is currently studying for a BSc in farriery, where she's gained distinctions and awards already for her research so far into lots of issues, particularly things like white line disease and so on, which I'm sure she can tell you about. Georgie, the reason I thought she'd be really good to do this talk is because she's anyone who has her clients, and I know we have some here, knows that she's really good at communicating about the feet and has a real passion for communicating, particularly about laminitis and the issues with weight and so on. So yeah, I was really keen to have her talk with us today. So thank you very much for joining us, Georgie. So if you don't mind unmuting,
there we go,
and then sharing your screen, hopefully that will all work. Okay, it's screen sharing, so that's perfect. Yeah, perfect. Okay, great. Thank you.
Lovely. Good to go?
Yeah, good to go.
Good evening, everyone. Oh, yeah. Good evening, everyone. So during this talk this evening, I'd like to cover the basic anatomy of the hoof, what laminitis is, and the different stages along the timeline of this condition and how it affects the horse's hoof. So to fully understand what structures are affected during laminitis, we have the hoof capsule here. So this is a sagittal section, so it's cut down the middle, and it provides us with a good view of the bones, soft tissue, and the horny structures which make up the whole hoof capsule. So the bones within the hoof are the distal phalanx, which I've labelled here as P3, and it's also known as the coffin bone. The distal sesamoids, commonly known as the navicular bone, and you can just see the distal aspect of P2, which is also named the middle phalanx. So these three bones articulate to make the distal interphalangeal joint, commonly known as the coffin joint. And the distal phalanx is suspended within the hoof capsule via the interdigitation of the derminal, which is the sensitive laminae, and the epidermal, which is the insensitive laminae. And the back part of the foot is predominantly the digital cushion, which is a fibrous tissue, and it makes, to what we can see from the outside, the bulge of the heels. The deep digital flexor tendon inserts on the palmar aspect of the distal phalanx, and its function is to flex the distal interphalangeal joint, the coffin joint. So the sensitive structures within the hoof capsule are protected by the hoof capsule from what we can see on the outside, which is the frog, the sole, the hoof wall, and the white line, which provides a flexible junction between the sole and the hoof wall. There is an extensive network of blood vessels within the hoof, and damage or compromise to the vascular system will have dire consequences. So, a threatening condition and should always be treated as a clinical emergency. The cause can be from a systemic condition, which restricts the blood supply to the laminae corium via the arteriovenous anastomosis. A mechanical cause, such as trauma and stress on the laminae, result in separation and inflammation. Laminitis can affect the forefeet and the hind feet. Laminitis is a breakdown of the dermal and epidermal laminae attachments, resulting in the sinking of the bone column or rotation of the distal phalanx and the hoof capsule in relation to one another. This causes structural and mechanical damage to the foot. what we must remember is the hoof capsule works as an integrated unit. It is a bioengineered design to support and suspend the whole horse above it. Its function of it, if the function of one anatomical aspect is compromised, it will affect the surrounding supporting structures. So I'm often asked when I'm at routine appointments if I can see any laminitis in the foot. What we must understand is laminitis is classified into different stages along a timeline. Morphological and physiological changes take place further along this timeline. So if chronic changes are apparent, we are already in trouble. So the first stage of laminitis is called the developmental stage. During this stage, the horse is exposed to the cause. The structural damage to the laminae is present, but there are currently no clinical signs. And then we go on to the acute stage, and this is classed from the onset of clinical signs to the beginning of any bone movement within the hoof capsule. Inflammation and separation of the epidermal-dermal attachments of laminae lead to biomechanical weakness, vascular compression, and acute pain. This causes the horse to adapt a leaning back and shifting stance. An increase in digital pulse and an increased temperature of the feet can be felt, and a reaction to hoof testers on the sole of the toe. The removal of the cause and immediate treatment gives the best possible prognosis. Vet and farrier involvement should be sought immediately for the administration of pain relief and for the hoof to be stabilised to prevent any further damage and progression onto the next stage. These treatment plans should be based on the individual patient, considering the cause, clinical signs, the conformation of the hoof, and what structures are able to weight bear at that time. A deformable surface across the solar surface of the foot will allow the load to be shared from the hoof wall to the sole, frog, and bars at the palmar aspect of the foot. This can be done by stabling the horse to minimise movement with a deep wood shavings bed, the application of frog support pads or styrofoam pads, and trimming should be conservative at this stage by preserving solar depth and hoof wall thickness. Moving the breakover in a palmar direction will aid in reducing the force on the laminae from the pull of the deep digital flexor tendon. So this horse had acute laminitis. The signs were immediately detected by the owner and with the cause removed and first aid administered. These photos were taken 5 weeks later. With the quick reaction from the owner, this prevented the laminitis from progressing further, thus the horse had returned to soundness without any further damage occurring, which would cause morphological changes to the bone structures of the hoof capsule. So then we move on to the acute founder stage. The acute founder stage begins when we have bone movement within the hoof capsule. The incorrect orientation of the distal phalanx crushes the circumflex artery and the solar depth is lost. The hemorrhage of the damaged vasculature increases liquid within the hoof, which cannot be compressed because it is within a hard structure, causing immense pain and hypertension. Unfortunately, it's a vicious cycle. The lameness will be severe with reluctance to move and the ability to pick up the feet. No morphological changes of the hoof capsule will be seen, so correctly marked, good quality radiographs allow us to see the phalangeal and hoof capsule alignment, sole thickness, joint margins, and bone density. To be able to treat accordingly, our aim is to reduce the mechanical stresses on the laminae. So this horse was presented to the vet with severe bilateral forelimb lameness, reluctance to turn, and uncomfortable stance. With these radiographs, it enabled us to see that there was minimal distal phalanx rotation and good sole depth at this time. He shouldn't have really been as lame as he was, but after a conservative trim, we reduced the dorsal hoof wall leverage on the laminae and we applied frog supports, and then the horse was put on box rest with deep shavings and provided with pain relief. And he improved as the progression of the laminitis was stopped. So if we go back to the sagittal section of our hoof capsule and look at hoof mechanics, in a healthy hoof, which is what we've got on the screen now, we can see in the healthy hoof, the laminae are under tensile force, which they pass this load from the bony column onto the hoof wall. The extensor tendon and the laminae attachments are in harmony with the tension of the deep flexor tendon. So this is a sagittal section of a laminitic foot. The green arrows show how the biomechanics of the damaged laminae are disrupted. As we are unable to remove the weight of the horse's body off the feet, the weight through the bony column and the pull of the deep digital flexor tendon cause rotation, and the ground reaction forces cause compression. So the chronic stages of laminitis are categorized into type 1 and type 2. So type 1 chronic founder, this is when the rotation of the distal phalanx has stopped and there are no radiographic changes to the bone. There are, however, long-term pathological and morphological changes to the foot. The diagram on the left is of a chronic laminitic foot when the coronary corium and the horn-producing structures have been affected, reducing the growth of the hoof wall at the toe. As the heel growth continues at a normal rate, the hoof capsule becomes distorted. The growth wings will be closer together at the toe than at the heel. And the blue arrows on the radiograph on the right show the laminal distance is thickened, and the result of reduced horn growth at the toe hinders new laminal attachments. So these two images show the laminar wedge. So a laminar wedge is present at the chronic laminitic foot as a result of abnormal hoof production after the laminae has been damaged. It's a pathologic tissue formed in the laminal region to regain functional integrity of the hoof, which has been lost. And we also have a chronic founder type 2. So this is when there are radiographic changes can be seen to the distal phalanx, compression and damage to the solar arterial plexus causing remodeling of the bone, further complicated by osteomyelitis, which is so then the tip of the distal phalanx is absorbed through this, and as the deep digital flexor tendon contracts, chronic abscessation of the sole is likely. The horn tubules are distorted by the compressed coronary band, causing them to grow at 90 degrees to the limb. It is doubtful that the horn will return to its function as a composite biomaterial, and unfortunately these horses have a poor prognosis. We can also have what we call a sinker. A sinker involves the total destruction of the epidermal dermal-laminal bond all the way around the hoof. A depression can be palpated around the coronary band as the bone column moves distally and is loose within the hoof capsule. Radiographs show little or no rotation, demonstrating the importance of a correctly placed founder marker. Gas pockets can be seen on the dorsal aspect of the hoof on radiographs, requiring a dorsal hoof wall resection to allow drainage of the hemorrhage. This image is of the solar surface of horse's foot from the previous radiograph. The sole is prolapsed and there was visible deterioration of the sole as the bone column penetrates the sole surface. Unfortunately, the horse was euthanized. So radiographs can provide us with a 2D image of structures within the body. Correctly placed radiopaque markers of a known length provide external reference points and the ability to take measurements and compare the results to future radiographs. The founder distance marker at the hairline on the dorsal aspect allows us to calculate any distal bone displacement. A clear ground line provides the ability to calculate sole depth. A marker at the true apex of the frog provides an external reference point, and a heel marker and dorsal hoof wall markers provides an outline of the hoof capsule. The dorsal hoof wall marker and the periantal surface of the distal phalanx of a clear radiograph, including the proximal and middle phalanges, allows us to calculate rotation angles. Capsular or phalangeal rotation can occur. The radiograph on the left is a horse with capsular rotation. So capsular rotation is the change of the periantal surface position of the distal phalanx in relation to the hoof capsule. And this can be treatable with a conservative realignment trim. The radiograph on the right is of a horse with phalangeal rotation. Phalangeal rotation is when the distal phalanx rotates from its axis with the proximal phalanges. More damage is caused within the hoof capsule, resulting in a longer treatment plan. The treatment is vastly dependent on the laminar pathology of each individual case as to the choice and outcome of the treatment used. Our aim is to change the forces acting upon the hoof, taking into consideration the cause, the hoof conformation, and what structures are able to weight bear. Teamwork and communication between the owner, vet, and farrier is vital, and prevention is better than cure. I hope this talk has been informative and increased awareness of the devastating impact laminitis has on the horse's welfare and effects on the hoof capsule. Thank you very much for listening.
Thank you so much. That was so interesting. Those x-rays are really frightening, aren't they? Seeing that.
Yeah.
Yeah.
Wow. I always think that the hoof slice things are just amazing, aren't they? I could look at those.
Oh, it's fascinating.
Hoof slice things.
Interesting. Yeah. What's the proper word for them? Hoof slices.
Yeah, so it depends which way you're looking at them, really. So.
Yeah. Yeah, definitely. Okay, we have an amazing load of questions here.
Really good questions as well.
Yeah, I think this is probably our favourite set of questions we've ever had, and I was just messaging like, wow. So hopefully, yeah, we've got Nicky and Georgie back. So Dee and I will pick the questions. I don't know we'll be able to get through all of them, but we'll try because they're really good. And if not, we'll try and follow up after. Dee, do you want to go first?
The great radiographs we've seen from you, Georgie. Victoria asked, why do so many radiographs not include appropriate markers? And I'm guessing, oh, sorry, carry on.
No, sorry. Yeah, it should be a must. Unfortunately, it can just be lack of knowledge on both parts, really, of what we actually need and how we can use them as it, you know. So when we're actually looking at the foot, we can definitely pinpoint exactly where that bone is. So just unfortunately it is just lack of knowledge sometimes. And we need to put it across more ourselves as well as farriers to say we need their markers so we know exactly where everything is and we can take measurements from them then and make up a better treatment plan. Yeah,
definitely. So once again, as you sort of ended your talk off, is getting that vet and farrier team together. And Nicky, do you sort of have any insight into perhaps why some vets might not place markers on radiographs, or why some might?
Yeah, I think, I mean, if I'm honest, I don't always put markers on, which George will probably kill me for saying.
You're admitting now.
I know, I'm bad. No, I think a lot of the modern X-ray systems actually, with post-processing, you can do the measurements without actually necessarily having the markers there. So it slightly depends on what system you're using. And I think the key is, you know, if you're taking X-rays for the farrier to use, then, you know, the sensible thing is that you say to the farrier, what do you need from these X-rays? What do you want me to have on there? What measurements do you need? And I think, you know, I'm really lucky in that our farriers come to us. I have the X-ray machine there and I can say, what do you want? And they can be fairly rude to me about what they want. And that's fine. I think sometimes, you know, it's sometimes difficult. You know, the vet will go out, they'll be asked to do a set of X-rays, then it's sort of asked to go to the farrier, and then the farrier's kind of going, oh, I wish I'd known about this before. So I think the key is, as an owner, what I would say is if you've got a pony with laminitis, ask your vet and your farrier to have a chat right from the beginning. If you can get them both there with the x-ray machine and all their kit, then I think that's really, really nice, because I think everybody just gets to have their input. The farrier and the vet can have a chat before they take the x-rays. They can take the x-rays, they can look at those x-rays together and decide on that therapeutic plan together. And I think that is the best outcome for the horse. And it takes a little bit of organising and a little bit of kind of toing and froing between people. But if you can get that, I think, I hope Georgie would agree, I think it's really nice to all be there together to come up with that plan together.
Yes, most definitely. Yeah, it's the best way forward.
Yeah, brilliant. Okay, I've got one here which I'm going to ask because I saw an argument on Facebook about it earlier from Martina. This is for you, I think, Nicky. Can you slow down or manage PPID without medication but with good management? It's PPID, not EMS.
I think the current literature would not support that that is possible, because you've essentially got a dysfunction that's going on in the pituitary gland. I think what you can do is you can manage your horse. So, for example, we said that EMS can predispose that horse to PPID later. So if you prevent obesity, then you reduce the risk of EMS developing, and therefore you reduce the risk of PPID developing. So yes, it makes sense. If you manage the horse well throughout its life, then perhaps you've got a good chance of reducing the risk of them developing PPID. I'm not aware of any really strong evidence to say that management will slow progression. I think, unfortunately, some horses that you treat, and the Pergolide is the drug of choice for treating PPID. I think some horses, the side effects outweigh the benefits for those horses sometimes. And I think, people in that situation, I think it's really hard, because you want to try something for that horse, but if the medication kind of makes them worse, then that's a really difficult situation. So I think my thing would be, if you're going to try some other management changes, especially if you're going to try any supplements, I always say to people, keep a diary of how the horse was before it went on to whatever management change or whatever supplement it was, and keep a diary while they're on that treatment. And then if you think, I'm not sure if it's making any difference or not, stop the treatment and see if the horse changes again. So I think it's just about, I don't think there's any harm in trying management changes and trying things. But I think the key is with PPID is actually staying on top of things like secondary infections, for example. So, if that horse gets a wound, it's going to be slower to heal. If it gets dental disease, it's going to be a lot harder to treat. So I think staying on top of those things really helps manage the sort of problems associated with having PPID. Does that answer the question?
Yeah, I think so. That makes sense. Brilliant. Thank you.
Yep. Okay. Shall I go next?
You go next.
This is probably one for both of you, for both of your inputs, I think. So Martina asks, would you recommend shoes or bed with boots for recovery for laminitis, and why do you think this is?
Sorry, it distorted there.
Oh, sorry, did you not hear me?
No.
Okay, let me repeat this again. So Martina wants to know whether you would recommend shoes or barefoot with boots for recovery for laminitis, and why would you think this?
So I have a lot of positive treatment plans which are barefoot. We can get at the feet as often as we like without having to then undo any shoes that we've put on. So if you're going down, I tend to stay away from nailing, because obviously you've got a traumatized hoof capsule already. You don't want to be adding to that. And then you've got you glue on options, which are obviously, less traumatic. But I find it limits on how often you can get to that horse and make some, small changes to their feet. So I tend to say barefoot is, I do think I prefer it. We've got more access to them, and you can, so if you ever just need to make little changes, because sometimes you see them, every other week or every 4 weeks, and the glue-on shoes are very expensive to be taking all that off, to be making changes to then put it all back on again. So it's just about building a healthy hoof capsule again.
That's interesting. And Nicky, do you have any thoughts on that?
Sort of.
I think it varies horse to horse. I think, certainly I agree with what Georgie said about nailing on. I think, if you've got a sore foot and then someone hammers nails into it, then that's going to be a bit sore. I think if you've, especially in the acute stages, if you've got a really painful foot, asking them to lift a foot to do anything to it is sore as well. So I think if you've got, some really good cushioning under that foot and you've supported the foot, then I prefer not to put shoes on them in that stage. I like the glue-on shoes, but they, as Georgie says, that they're expensive, and if you've got to kind of fiddle around with them and take bits off and things like that, then that's a bit of a pain. I have had a few horses that eventually, I think because their sole becomes so thin, they're just very prone. They stand on a stone, or they stand on a bit of hard ground or anything like that, and they're sore. So I do think sometimes these sort of longer term cases, the only thing that's got them comfortable is putting a pair of shoes on them, but that tends to be once they've stabilised. Then it might just be that actually putting a pair of shoes on them is the thing that keeps them comfortable. So it really varies for me on that particular case.
Yeah, that's really interesting. Okay.
And I suppose we're quite lucky. We do have access now to all different types of boots, and you can have padding systems and different leverages inside and things like that. So we do have a lot of options.
I think Dee and I have got all the hoof boots between us. All of them.
Very handy for abscesses, definitely.
Yeah, definitely. Okay, I've got a nice one here from Lynn. Lynn was told that exercise is key to managing EMS, not just in relation to weight control, but also its positive effect on metabolism. We've seen some really nice studies about the effect of even just walk exercise on metabolism. But Lynn says now she's paranoid about giving her horse a day off. So what level of exercise is ideal for a horse with EMS? Oh, do you want to take that first, Nicky?
Yeah, I wouldn't be paranoid about having a day off. I think we all need it from time to time, so I wouldn't be too worried. I think, I think exercise, absolutely is key to it's key to metabolism, it's key to weight control. It's building a muscle, it's supporting your joints, it's doing so many other things. I think the right amount of exercise is always a difficult one. I think the key is probably a consistent level of exercise that maintains their fitness, maintains their muscle, and maintains their body condition. I think having a day off here and there is absolutely not going to make a difference. I think the worst thing you can do is this sort of yo-yoing where you don't do anything with them all week and then kind of go out, 5 hours on hard ground at the weekend and then chuck them back in the field again. So I think consistency and just making sure that their weight is controlled is probably the right amount. That's a very vague answer, but I think you have to. Yeah, I think it has to, but it has to work for your life because it's supposed to be fun, right? So there's no point sort of, oh God, I've got to ride this horse every day, and enjoying it. So I think you've got to enjoy it.
Mm-hmm. Yeah, absolutely. Thank you, Georgie. Did you have anything to add on that?
No, it's about right, really, isn't it?
We all need days off.
Yeah, people end up killing themselves over just trying to, not let them have a day off, and you think, no, just you got as well.
Yeah, okay. Okay, brilliant. Dee, your turn.
Cool. Okay, I've got a question here, but I'll probably put my little 2 cents into it first, if that's all right, and then I'll see what you guys think, Georgie and Nicky. So Victoria asks, so do you see laminitis as a disease in its own right, or a collection of symptoms that different diseases can trigger?
Good one.
So my thoughts on that is that yes, it definitely is a sign of that there's something underlying, but I also think that by maybe it has its own clinical signs that are very distinct to laminitis. So I think by maybe not calling it disease, we risk of maybe lessening lessening its importance. But then I'll be keen to see what you guys think.
So, sorry, Dee, could you just repeat the original question? I slightly missed the first bit of it.
Oh, sorry. So Victoria asked, do you see laminitis as a disease in its own right, or a collection of symptoms that different diseases can trigger?
I think it's a disease in its own right. I mean, yes, it's got lots of different triggers, but I think laminitis is the disease that we're treating, and I think it is. I mean, for me, a list of symptoms, something like navicular syndrome is as such because it can be one of many different injuries or a combination of injuries that lead to that syndrome. I think, I would call laminitis a disease in its own right, I think.
Yeah, I completely agree. I think it can get confusing because it is such a vast sort of subject that, but it is, I'd say it's disease in its own right.
Cool. Yeah. And I think it is a disease that we have to treat, but then we also have to perhaps look deeper into what's triggered it and deal with that. Okay. Cool. Over to Tamsin.
Okay, I'm just scanning through. There's at least 3 questions which are kind of linked, so I'm just going to summarize them, which are basically about the need for movement versus box rest for a horse with laminitis, and when you might do both. So one of the questions had some concerns about, for example, if the guts stop moving and so on, and the stress from stabling and so on, and I know there's a lot of concern about if you increase movement, then that might increase blood flow in the foot and therefore help laminitis. So we've got quite a few different questions coming from different angles, but kind of just to summarize, what are your thoughts on when it is appropriate for to use box rest and when it is appropriate to move a laminitic? I know that's a really big question. Who wants to go first?
I think Georgie should.
Give you some thinking time.
Got
the short straw, Georgie.
Yeah, it's very difficult. Obviously, each horse is an individual, but you've just got to be so careful until you know exactly what's going on, where everything is positioned in the foot. I would just really err on the side of caution because, it's such a devastating disease that I think you're best to err on the side of caution by keeping them quiet until you can get the vet there to, we can see exactly what's going on and then to look at, potentially increasing movement and things. But the rate you can get the vet to you to then help you, I think that's the best protocol really, than risk causing any more harm.
Okay. Do you have any thoughts, Nicky, on that?
I think Georgie's absolutely right. I think before the vet and the farrier have been there and come up with a plan, then I think absolutely getting them rested, deep bed underneath their feet, is definitely the way forward. I'm not a massive fan of box resting horses. I agree. I prefer them to be moving around because you've got that blood flow, you've got their guts moving. So it is. It's rare for me to put a horse on to strict box rest unless it really needs it. But I have to say, an acute painful laminitic is one that I am absolutely, I don't want him moving anywhere. Saying that, I will, once they're comfortable and they can do something, then I definitely think starting to getting them moving when you can, a very gentle, very low level, nice soft surface, a school or something like that, just to start to get them moving slowly. I would get them doing that as soon as I felt it was safe to do, but certainly not and they're so painful that just asking them to move is just cruel early on.
Okay, yeah, that's really interesting. We often see discussions about this on the Facebook groups for laminitis about, should you turn them out to get the blood moving in their feet? But it sounds like you disagree with that then and think that really it's rest unless they're kind of along that stage, so they're already healing. Is that kind of?
Yeah, I think once you've got that acute pain and inflammation under control, then certainly starting some controlled movement is definitely where I'd be aiming to be. But in those early stages, no. I mean, some horses won't even stand up and won't move with it, so
Yeah,
you don't want to be forcing it. I really early on, I really like horses that lie down and refuse to go anywhere, because at least they're resting their feet.
Yeah. Okay. Yeah. Brilliant. Thank you. Okay.
Sorry, so my internet just dropped out and dropped back in, and I've lost
That's okay.
all the chat
Don't worry.
questions.
I've got.
But I do oh, cool. I
Sorry.
do remember one which stuck with me, and I don't know whether you've had experience of this living in the UK, but we had a question from Australia asking about the effects of the bushfires that they had and sort of the bad air quality from the smoke, and can that be something that might trigger a laminitis episode?
Yeah, I saw that question. I think that's really interesting. I think I don't know, to be honest, if it does or not, but I would think if you get enough inflammation going on in the body, then laminitis is always something you'd be concerned about. Normally we consider it in cases with colic, where they've got a really high level of inflammation within the gut, and they get a secondary laminitis to that. But I don't see, if you had smoke inhalation and severe inflammation within the lungs, or burns and severe inflammation in the skin, then I think it's entirely possible that a horse would develop laminitis secondary to that. So yeah, I think it would definitely be on the list of things that you'd be looking out for, and you'd monitor them for.
Wow.
Yeah, I think I remember seeing some posts about not the air quality, but sort of the heat from the fires, which has affected the feet, and they almost kind of cook from the inside, and then you can get sort of dramatic loss of the whole hoof capsule as a result of that. I don't know if you had anything to add to that, Georgie.
Yeah, no,
Not something you've seen.
Cold here.
Yeah, too cold for fires. Okay, there's a couple of questions about, I guess these are interested in your take on these, particularly Georgie, but about, so what's actually happening with the pedal bone? Is it actually moving, like is it actually dropping, or is it that the hoof is growing kind of differently around it, or other things so one of the questions is phrased like, regarding capsular versus phalangeal rotation, is the phalangeal rotation not just capsular rotation but with high heels, because that's what the x-ray looked like? And then the other question is kind of similar, so is the pedal bone actually kind of dropping inside the hoof, or is it just that the hoof is growing differently? If that makes sense.
Yeah, so with phalangeal rotation, the pedal bone's actually off its axis with the middle and proximal phalangeal bones. So you'll see it's actually off if you put a guideline through the x-ray, you can see that it's actually off its axis.
Mm-hmm.
Whereas with the capsular, you've got hoof capsular distortion around the bony column, but that phalangeal alignment is still in line.
Okay.
If that makes sense.
That's really interesting. Okay. Nicky, did you have anything to add on hoof shape? Or?
No. Sounds good to me.
Okay, cool.
I think if I remember, we had some questions about ACTH levels and kind of the cutoffs during different times of the year. If you could comment on that, Nicky.
Yeah, it does vary through the year. I think the really nice thing actually now is that all the labs interpret the results in view of the time of the year. So they'll have reference ranges dependent on what time of year it is. And there's certainly better and worse times to test horses to get a more accurate result. So certainly sort of late spring, early summers, normally when we do our sort of annual tests on our horses to see where we are. That doesn't mean you can't test at other times of the year, but that's when you sort of get your better results. I think ACTH on its own is not a hugely accurate reflection of control of PPID or indeed PPID itself. So if you take bloods off a painful laminitic, for example, that pony will have a high ACTH. It does not mean it's got PPID or Cushing's, because ACTH will be high in ponies that are painful and sick. So a much more accurate measure of disease or of control is to do a TRH stimulation test, or a DEX suppression test is the other one, but TRH stimulations tend to be more common these days. And that gives you a much more, I still wouldn't use it particularly in a really painful animal, because I don't think you get a very good representation of underlying disease. I think the pain affects it and the stress affects it. So yeah, but I think that the problem is I've got a couple of horses that, their levels never seem to quite come under control, but they're doing really well. They're really perky. They're not getting, constant dental disease or sinusitis. They're not getting laminitis. And there kind of comes a point where you think, well, I've got a horse with a great quality of life. It's not got any secondary effects of it. So, that's good enough control for me. I've got another horse that, always looks as if she's got wildly out of control Cushing's, and I've run every different test on her and everything comes back as completely normal. So, and again, she's very happy. We just have to clip her every sort of month. So yeah, I think the tests are certainly useful, but I think the clinical signs and the quality of life of the horse also have to come into consideration for treatment, and it's finding the right balance for that individual horse. Yeah,
brilliant. Thank you. This is a good time to say we're having a webinar in a week or two about quality of life assessments. So, yes. So anyone interested in that, watch this space. Okay, it's getting pretty late, so maybe if we just do one more question each, if that's okay. I've got a nice one here. This is a case study of a horse with basically ongoing soreness. So Susan says, my mare is barefoot. She had laminitis 8 years ago, but she's continued to have very sensitive feet, which are much worse after trimming. Then my vet and farrier can't explain why or what we can do about it. So she had excellent recovery after the laminitis by fitting clogs for a couple of months, but obviously that's not feasible long term. She's fine on the grass, but she has this ongoing problem of being quite sore on hard ground, though Susan uses boots to manage that after trimming. What would you do with a pony like that? Is there anything that she can kind of do that might help her pony long term, or that you would be kind of testing for, or anything? Or are some horses just likely to have, sore feet after trimming, and that's kind of just the way they are? Who wants to take that?
I'm happy to start. It would be, I think, one of the things, and I mean, some horses with laminitis and some horses are just this way have particularly thin soles. So, for example, you have sort of thoroughbred types always have thin soles. They're really prone to bruising. They seem to get sore really easily, especially on hard ground. And I think some horses, if they've had some sinking of the distal phalanx due to an earlier episode of laminitis, then again they have this sort of quite thin sole. So I think, I'll leave it to Georgie to answer in terms of whether you can do anything in terms of trimming. But these are the horses that, quite honestly, I just get to a point where I think just put some shoes on them, and it just lifts their, because then the pressure's going on to their hoof wall or across their frog, depending on how you shoe them, and that bit of sole that's sitting under P3 that seems to get bruised is just lifted off the ground. So the chance of it constantly coming into contact with the ground, and I think you get these horses with sort of really flat feet, and they don't have that sort of nice concave shape to their sole, where so the pressure, rather than going on their hoof wall, is going on the sole, and the sole's not really supposed to be taking that weight and that pressure from the ground. So they're the ones, to be honest with you, that I just think they do really well in shoes, and I know some people don't want that as the answer, but sometimes it is.
Yeah. Okay. Brilliant. Thank you.
Yeah, I mean, it's very difficult without obviously seeing the hoof capsule conformation of a set horse. You often find that, yeah, if you are continually loading that sole, they just can't take it if they've had that damage there in the past. But it's also, it'd be interesting to know how they trim the actual like dorsal hoof wall. So, you know, you don't want to be taking any thickness out of that hoof capsule because, again, everything's just going to go south. It's containing it and keeping it strong. But obviously each horse is different, but you do see some and they never come back to how rock crunching their feet used to be. It is one of them. It's without seeing the horse, it's very difficult, but sometimes they do just benefit from being lifted up. But if they're comfortable on the grass and they're comfortable in the boots to take them onto the harder ground, then, you know, that's not a bad thing as long as they're comfortable on the soft without the shoes on. But each are different. It's just a case down to trim and management, really. And it's difficult to. There's not like a blanket treatment that can unfortunately make them all feel great again. Yeah. But you just do struggle with the odd one that sole sensitivity just seems to just stay there. Whether they've got, you know, murmurings of things that we can't detect because it's not full blown acute stage, but it's just still giving there a bit of, you know, discomfort.
Yeah, definitely. I think this is like we have a thoroughbred mare like that. It's just an ongoing thing where it's pretty hard to get her comfortable, but then others are absolutely fine, aren't they? So I guess every horse is just an individual. And
yeah, and it's interesting if she said that she went, she goes lame after every trim. It might be worth looking at if she does go sound later on in the trimming cycle and is more comfortable. Discuss it with the farrier and say, like, look, when her foot's like this, she is comfortable. Can we trim it more to keep with what she's grown back to keep her more comfortable in that respect? Because obviously if she does come more sound further along the trimming cycle, she's obviously grown back and got what she needs, and then you don't want to be taking that away when you come to trim her. So that would be an interesting way to look at it as well, just to you know, see what you're taking off, which, you know, you shouldn't be really.
Okay, thank you, that's really helpful. Okay, thank you. Dee, did you want to ask any? I can see one that is a question for Dee. But
yeah, I'll probably take this one as the last.
Yeah,
okay. So Louise asked, is there still a risk of laminitis this time of year? A lot of very green grass, about 15 centimeters long at the moment, but she's hoping that it's okay because it's autumn. Any thoughts on this?
Yeah, sadly we see it in autumn as well. Yeah, it's traditionally thought as this sort of spring grass coming through, but I mean definitely the last few years I've seen quite a few cases in autumn. I mean, saying that, we've currently got about 130 horses turned out on autumn grass, and I'm not going to speak too soon, but, you know, we've not done a huge amount about it. We're just watching them carefully. So I don't think, I think if you've got a horse that's prone to laminitis, then you need to be more careful. If you've got a horse that's not had laminitis before, I think, you know, you just need to watch them, and you need to watch them carefully, check for pulses, check for any lameness or anything like that. Yeah, but they can get it any time of year.
Brilliant. Do you see much autumn laminitis, Georgie?
Yeah, this year's been a really strange one, and I think it all boils down to the weather that we have. Like, if you think of the beginning of the summer, when you normally start to see the numbers creep up, we had such a hot, dry spell that there wasn't necessarily any of this flush grass coming through, and their feet were still quite dormant in their amount that they were growing. And then come June, end of June, July, we had all this rain come, all this grass shot up, their feet were growing like crazy. I had horses dropping down like flies with laminitis, but then it plateaus. But we've started to get this warm, wet weather again, and even you just look at the droppings in your own horse's field, that you can tell that the grass is shooting up through because they've gone, you know, quite loose again. So it's and it is difficult. You can't really pinpoint it because our weather's so changeable that we don't really have a year in, year out that's the same, is it? It's almost shifted slightly.
Yeah.
So I think probably bottom line, we have to think about laminitis all year round. And I'm quite a passionate advocate of that. And I think if anybody was on the World Horse Welfare webinar just before this one, and you saw kind of the grass growth curves across the year, as Georgie said, you know, sort of late spring, summer, we might have a bit more rain. You'll see the grass grow up. Then we get the drier weather in late summer, the grass growth will grow down again, and then we get more rain and wet in the autumn, and we get the grass flush again. So I guess also for Louise is kind of thinking about what condition her horses are in already. You know, are they already overweight, or do they need to lose weight? And then thinking about actually how much grass they should be having to going forward. But yeah, I think definitely sort of keeping our eye on the ball all year round is important.
With your research, Dee, was it were your levels of laminitis, they were quite high in autumn, weren't they? Was it nearly as high as summer and then dropped a bit over winter? Was that right?
So we looked at sort of the rate of laminitis over the year, and we had like the lowest rates were sort of March, April. Then it shot up over June, July, I think, were our highest. It went down again, I think, in July, and then we had another smaller peak in autumn.
Okay.
And then another peak in January, but not as large as sort of what we had in summer. So yeah, it definitely kind of does seem to mirror our grass growth cycles. And sort of the question also about, you know, when does grass stop growing in winter? Well, in the UK, sometimes it doesn't.
Yeah, if it's so mild. Yeah, absolutely. Okay. We should probably leave it there because I feel like we've asked a lot of questions of our kind speakers. I'm sorry we didn't get through all of them. We've left a few questions that we've answered in previous webinars, so particularly things around how to manage specific situations, like, for example, if you've got a complicated situation with your own horse, like you can't exercise it and you need to lose weight, for example. We've got whole webinars dedicated to different weight management methods, and there's been a couple of questions about reversing EMS, which is covered. So all these that are recorded, sorry, that's why I'm going on. I'm not just saying so you've missed it. So they're all recorded. You can find all of the information and so on the care pages. But last week's talk with Kathy McGowan had a section on reversing EMS, which she which she does feel is possible, and talks about there. So yeah, I hope that's helpful. Yeah, we've got some really lovely comments from everybody saying thank you very much. So thank you.
Yes.
Huge thank you to our speakers. That was brilliant. It was such an interesting evening. Really enjoyed it. Thank you.
Yes, thank you very much.
Having us.
Sorry.
Thank you for having us.
Oh, thank you. Maybe we can do more. Okay, so yeah, thank you everyone. Bedtime, I guess.
Yeah. Good night and have a good sleep, everyone.
Yeah.
Thank you very much.
Thank you so much. Okay, take care. Good night, everyone.
Thank you. Bye.
Bye.